Hi, Mrs. Johnson. I'm Jen, and I'm going to be teaching you about intermittent self-catheterization today. I understand that you're having some issues with chronic urinary retention, so this is something you can either do by yourself at home or you can have a family member assist you too. I think that this method of controlling your urinary retention will greatly improve your quality of life, and I have a pamphlet here for you that I can give to you at the end, but I'm just going to read off of it for now. So, intermittent self-catheterization provides for a periodic drainage of urine from the bladder. It protects the kidneys and reduces the incidence of UTIs and promotes continence. So, as you know, the urinary retention that you're suffering from is the inability to empty the bladder completely while voiding or going to the bathroom. And eventually, chronic urinary retention can lead to overflow incontinence, which is basically when your bladder becomes so full and overstretched that you can involuntarily leak urine. And another complication of urinary retention is chronic UTIs and possibly kidney stones, which we want to try to avoid as much as possible. Self-catheterization promotes independence, so you can go about your day without worrying about carrying around a drainage bag or having any unexpected leaking. And another reason why we prefer intermittent self-catheterization over an indwelling catheter is that there's a reduced risk of infection and UTI, because with indwelling catheters you have to be very careful with maintaining a closed system, which might not be very easy to do on an everyday basis and can actually be quite difficult. So while we're in the hospital, we perform catheterizations on patients like you using sterile technique, but at home you can use a clean, non-sterile technique since there is a lower risk for cross-contamination. So first off, you want to make sure that you wash your hands with soap and water before each catheterization, because while it's not sterile, you still have to be clean. Make sure that the catheter is generously lubricated, and after that you can use a hand mirror or whatever kind of mirror you want to use to visualize your anatomy to see where the urinary meatus is located, so basically just where the opening of your urethra is. And once you visualize that, some women find it useful to place a finger on or in the vagina to direct, and then after that you can direct the catheter into the urethra. As for positioning, there's no one specific position you need to be in. It can be accomplished standing, sitting, or laying down. So feel free to experiment with your body and see what's comfortable for you. Insert the catheter about 3 inches into the urethra in a downwards and backwards motion. After removal, the catheter should be cleaned, rinsed, dried, and stored in a plastic bag or case until the next use. So the catheter should be cleaned in either an antibacterial liquid soap solution or a betadine solution. And generally, you should be self-catheterizing every 4 hours or 4 to 5 times a day to prevent the bladder from over-distending. And remember, for this to be successful and to improve your quality of life, you should be establishing a schedule for catheterization. And on that same note, you should be keeping to about 8 to 9 8-ounce glasses of water or any liquid of your choosing per day to prevent the bladder from over-distending. And now I'm going to demonstrate catheterization for you. Alright, so I've washed my hands, so I'm just going to put on my sterile gloves. And now I'm going to take a swab that is sterile, and I'm going to clean around your labia, and then your urethra. And now I'm going to take the catheter, which has already been pre-lubricated, in the collection cup. Place that in there. I'm going to insert it. And then I'm going to place this aside to dispose of, as well as the catheter. And then obviously I'm doing this with sterile technique, but at home you can use clean technique. So now that I've cleaned everything up and you're nice and comfortable again, I'm going to give you this pamphlet to read over about self-catheterization, and I will be back in a few with your discharge orders.